She was born and raised here in Salt Lake City, attended East High School, was an outstanding student, and from the beginning wanted to study medicine.
I decided when I was about in the 8th grade that I wanted to become a doctor. And the only people that didn't think I was crazy were my parents, who said, sure, if you want to do that, go ahead. But I encountered a lot of discomfort along the way, because most people in that day and age didn't think women should do that.
When she met with, I don't know if it was a professor or a mentor, after her Bachelor of Science, when she was thinking of going into medical school, and that older senior person looked at Liz and said, you know, Liz, that by going into medical school, you are taking a young man's place.
The fact that Liz was going to take a man's place might have been suspected. But once she got in, she clearly showed everybody that that was not going to be the case.
And knowing Liz, that was enough. That was enough to fuel her desire even more to go into medical school.
I realized that being angry and frustrated about that wasn't going to solve the problem. What I had to do is, just like when I was a young girl, my parents said, you can do anything you want if you want it bad enough, and you keep trying. So I decided, I'm just going to try hard. I'm going to show them that I can do it.
She started and completed a residency in pathology at Mass General Hospital. One of the pioneering elements of that was that she became pregnant. We wanted to start a family. Once again, the ambivalence of the male-dominated medical community said, this is highly unusual. But most of her colleagues, fellow residents, were also starting their families, and she said, why can't I do that?
Having him was the most amazing, transformative experience, because up to that point, I had thought that I was really just interested in medicine. And all of a sudden, here was this person who needed me more than anyone else on earth. And I was just transformed by that experience, to realize how much fun it was to have little children in your life.
Liz loves what she does. She describes things that she sees under the microscope with such energy.
I get very excited about the ideas that I want to champion, and I can get other people to get excited about those ideas, and when they do, they forget themselves just like I forget myself, and we get to work.
Liz's contribution to the field of pathology in general is unmatched, and she's done a lot on a national and international level.
Liz Hammond, the College of American Pathologists, Pathologist of the Year.
I was very involved in research because I've always wanted to find ways to change patient care. And I knew that the only way to do that was to conduct controlled experiments.
She has persistently pursued the notion of dealing with truth as she saw it. And to her, truth was what she could show with overwhelming statistical and research data.
Liz, 20 years ago exactly, 1989, described for the first time something we call antibody-mediated rejection, which is a different form of rejection of the organ.
I knew that what I was finding was true. And I knew that someday the evidence would confirm that I was right. But I really didn't think it was going to happen until I was dead. And so I felt relieved and pleased.
Antibody-mediated rejection was only recognized formally by the International Society for Heart and Lung Transplant in 2005. Liz, 20 years ago, had already published a very large series.
I also had very clear priorities about what mattered to me. And those priorities were set early in my life based on the value system that I was taught by my parents.
I would call Liz on a Monday, or I'd send her an email, and many a time she'd say, I'm with the grandkids in Washington, or I'm being I'm playing grandma this weekend. And then I would hear about her experience the next week, and she would show the same enthusiasm talking about her grandkids as when she talks about her pathology.
She was well mentored by her parents, by the academics of the University of Utah, and all through her training. And she has become a mentor of others.
Doctors have big egos. Doctors of her stature have very big egos. Liz will take in medical students. She will take in fellows, residents. Everybody's welcome to pick up the phone and call Liz and meet with her to go over an interesting case, and she will do it.
I can do whatever I want with my life because people have been there to help me and lift me up when I needed them to. And so I feel like I have the same obligation to lift others, to help them realize their potential. I get a great deal of joy from that. More than most anything, it's sort of like being a mother over again, is that you can help people achieve their potential when they don't even know they have it.
She has a lot yet to discover and to contribute. She is a person who loves change.
I have to be involved in order to be happy. And I have skills that I think I can still apply because I still have the energy and I still have the knowledge.
She's always wanting to uncover something else, find the next piece of information that will change and improve the lives of patients.
I want to deeply thank the University of Utah for this extraordinary honor. As in any life, my life would not have been, I would not have been able to accomplish what I've accomplished without the help of many people. My parents, my siblings, my husband and children, and many professional colleagues and friends who've helped me along the way at key intervals. I'm grateful to all of them for their help and support in making this possible. I am especially grateful to my sister Kathleen Hale Webb, who was an inspiration to me throughout her life.